And hello to everyone. So yeah, I quickly just want to go over a little information about Evolve, who we treat, a little more about the structure of our program and what our admissions process looks like. So here is our clinical leadership team for Northern California. We have Dr. Verma, who is our medical director, and also our psychiatrist that sees all of our kids in Northern California. She's fantastic. We love her. And we have a lot of other supports as far as clinical and all things operational, both at the residential and outpatient levels of care. So Evolve is just for adolescents. We are specifically designed to treat 12 to 17-year-olds. We're also a dual diagnosis program, meaning we treat kids struggling with mental health issues, behavioral health issues, and or substance abuse issues as well. So as you've seen kind of throughout this webinar, we do offer the continuum of care, which is so great about Evolve. We have the residential program, PHP, and IOP options. This is a list of all of our locations. So we are only in California. For residential, we have 4 options in Northern California and 7 options in Southern. And then for PHP IOP, we do have our newest Danville location, which we're so excited about, and then San Jose, as we just learned about, and then San Diego and virtual. The great thing about our virtual program is that we're able to help any kiddo that resides within the state of California, since it's all online. So Evolve does utilize quite a few different types of therapeutic approaches. I think as we heard a little bit about, we mainly are utilizing DBT. That's definitely our strongest modality within Evolve, although we do incorporate other approaches as well. All of our Northern California locations are considered DBT informed. We very commonly have parents and other clinicians that are reaching out to us specifically because DBT is recommended for that child. So at any one of our locations, the kiddo will get a good dose of DBT. We do have the ability to offer a comprehensive DBT program as well. This is our residential program in Tarzana, which is in Southern California, our Van Alden location. It is fully comprehensive, so we're really excited to be able to offer that also. Here's a little information about how our residential programs work. We have a maximum of 6 kids at each of our facilities. So it's a really small, intimate setting. There's a 3-to-1 client to therapist caseload, and there's also a 3-to-1 staff to client ratio. So there's 3 clients per therapist, and there's also 3 clients per staff member, just when it comes to supervision. That 24-hour supervision and support is really important to us. Even overnight, we have 2 staff members that are checking on the kids all night, every 15 minutes. The length of stay in our program typically is about 30 to 60 days. Of course, every kid is different and it can depend on a variety of factors, but typically we're seeing kids around that 30 to 60 day mark. We treat all genders. So our programs are co-ed. We treat boys, we treat girls, we treat kids identified as transgender. We treat kids that don't know what gender they identify as. We accept everyone at our program. Everyone is welcome. Each kiddo gets 3 weekly individual therapy sessions. So they're meeting with their therapist 3 times weekly individually. They're meeting with their therapist twice weekly for family therapy. And Evolve puts a very heavy emphasis on the family involvement in the program. We feel strongly that that really indicates how successful our program will be for a kiddo, is really how much the family is involved throughout the whole entire process. We have a psychiatrist that meets with our kids weekly, every single week for medication management. There are a variety of group therapies every single day. We also provide time Monday through Friday for schoolwork. We actually, in all of our programs, have like a separate school room for kids to go to so they can actually feel like they're separating their day off and now it's time just to focus on school. We have the ability to offer one-to-one patient monitoring if that's needed. If there is a safety issue that comes up, we do have the staffing to be able to watch that client on a one-to-one basis. All clients also enter our program on a one-to-one monitoring, just as we're getting to know them and kind of assessing exactly how safe they are. And then we have on-site nursing every day as well. So a little more about those group therapies. We offer quite a bit of experiential therapies at Evolve. We did develop this program specifically for adolescents. So we not only wanted to find things that would interest them, but also potentially expose them to a new passion, a new coping skill, a hobby that they might not have otherwise had the opportunity to experience. So we're doing things like art therapy, music therapy, drama therapy. We do equine therapy at all of our locations, which is therapy with horses, which the kids love. We're also all about getting them, up and moving and getting their bodies moving. So we do yoga, we do hiking, we incorporate all of that at all of our residential locations. So here's a little more about our outpatient programs. As I mentioned, all 4 of our locations do both PHP and IOP. At Danville, San Jose, and San Diego, our partial hospitalization program is a hybrid model currently, meaning that the first half of the day is in person, and then the second half of the day, the kiddos go home and finish out the day virtually. That second half of the day is also our IOP program. That's when our IOP kids join. So for PHP, it's a full day of programming Monday through Friday. For IOP, it's really kind of like an after school program because it doesn't start until the evening, and it's typically about 4 days a week. And in both of these programs, either PHP or IOP, kids are getting individual therapy weekly, family therapy weekly, psychiatry weekly, and then group therapies every day. A little bit more about that parent and family participation. All of our programs do have at least one family therapy session weekly. That includes the parents, the teenager, and the therapist. In our residential programs, we provide that additional family therapy session that's just the parents and the therapist alone. And so a lot of coaching often takes place in those sessions. In our outpatient programs, we do have that weekly multifamily group, which is all parents and all kids, which is great. And then we offer parent support groups as well as parenting workshops. And there's more information can be found on these 2 on our website. So make sure to check that out. And then as far as our insurances, we are in network with Anthem Blue Cross, Blue Cross Blue Shield, and Health Net. We are able to work on an out-of-network basis with quite a few other private insurances. And in some situations, we're able to request single case agreements as well. So if you ever have a specific question, if you have a kiddo that you're wondering if it's an insurance we can work with, definitely feel free to give us a call. It's free for us to do a benefit check to find out not only can we work with this insurance, but how much the family will be responsible for. And lastly, this is just a little flow of what the admissions process looks like. The best way to start the process is just to give us a call. We are happy to answer any questions you have, any questions the family has. We will, tell you whatever you need to know about Evolve. We want the family to feel fully comfortable with whatever decision they're making. So we want to feel that they have all the information that they need about our program. We will go over money. We will go over the insurance right from the start. We want to make sure we're super transparent and super upfront with parents when it does come to that piece. It's not something we want to introduce way down the line of the admissions process. We go over it right from the start, no secrets there. And then the next step is assessing and making sure that Evolve is going to be a good clinical fit for the kiddo. And Evolve puts a really strong emphasis on this piece. Because we want to make sure that we can effectively treat the child. So we do an assessment with the parents, we assess the kid themselves, we're collecting records as far as if they're coming from a hospital, we want records, another treatment center, if they have an IEP through school. We really want to gather as much information as we can to help determine whether or not Evolve is a good fit. And then should all that work out, depending on availability, we go ahead and schedule the assessment. And I think in both cases for our outpatient program and our residential program, assuming there is a spot available, this whole process can happen fairly quickly. It kind of just depends on what's going on clinically and specifically with that situation, but there have been many times we've been able to get kids into our program pretty quick. So that's fantastic. And we have our phone number up here. It's also on our website as well. But that's pretty much it as far as admissions.